You can have pain without injury. So you can be sore but absolutely safe. Fear, worry, tiredness, lack of movement, anxiety, excessive attention can all amplify the pain, and here's how. Evolution has programmed us to be on the lookout for potentially threatening or painful experiences. This has been vital for human survival, and it was especially useful in prehistoric times when the threat of physical danger loomed large. Having a physical injury back then could mean not getting food or being left behind from your tribe. Not hearing that sound in the bush could be the difference between life and death. In our modern world, we are safe, but our brains still act as a threat detector, constantly scanning for potential dangers in our environment. Our brains also learn from past experiences, creating memories of dangerous situations to help us avoid similar threats in the future. Today, this fear-based system impacts our behavior, leading to our nervous system being revved up, the release of stress hormones like cortisol and adrenaline, excessive muscle guarding, hypervigilance, and avoidance of situations associated with negative experiences. This means we can feel painful sensations for a multitude of reasons. In today's world, we can be sore but completely safe. Our brain's built-in survival mechanism to scan for pain has been honed throughout evolution. We have a network of nerves all over our bodies supplying every body part. Sensory receptors in our nerves detect potential threats and can be triggered by several factors, including mechanical force, temperature changes, immune system changes, blood flow, injury, fear, anxiety, etc. These receptors send a signal to the spinal cord and on up to the brain. For the purpose of this example, let's call these sensory receptors entry-level employees. Let's call the spinal cord middle management, and let's call the brain the CEO. The spinal cord collects this information and decides if it should ignore it or send a report up to the boss. An example of it ignoring it might be when you sit on a harder surface, but you don't notice it as you take care of the issue by readjusting your sitting position. The spinal cord passes information onto the brain, and the brain processes this information and takes action. That might be stopping the movement or exercise or ringing the physio or doctor. It might be limping around for a few days. If you're worried or concerned about the pain, maybe because of fear or because of it's preventing you from moving properly, or previous injury or painful experiences, or you have a sporting event coming up soon that you need to be ready for, or the pain has just persisted for a long time, the brain will analyze any incoming messages of danger very closely. The brain modifies the sensation of pain by either amplifying or suppressing it. The term for this is descending modulation. So think of this large company with the brain as the CEO, who gets monthly reports from all departments: your neck, ankle, knee, hip, back, etc. The monthly reports are written up and analysed internally before being sent to the middle management, who make some adjustments before finalising the report and sending it on up to the CEO. Imagine that department is underperforming. The CEO is concerned and now asks for a weekly report, and also requests that the initial data bypasses the usual chain of command and is just sent directly upwards. This process is called descending facilitation, where the brain is on the alert and listens carefully for any danger signals. The CEO decides which information is important. If the brain isn't interested, descending inhibition happens, and those danger signals are blocked by releasing drugs that descend the spinal cord and block the upward flow of information. This can happen based on previous experiences, knowledge and information, memories, motivation, etc. The brain knows that the activity is safe and healthy and blocks the danger signals. So attention, anxiety, fear and worry can amplify the pain, but on the other hand, understanding pain, good experiences with movement, reassurance and plenty of movement options can reduce the pain. Let's think of a deadlift example. Doing a deadlift, on your third lift, you feel your back get sore. You automatically think, you'd been told mind your back and keep it straight, and especially careful in the deadlift. You also had that back pain as a teenager, which caused you to miss out on that holiday, and your mother has had a bad back on and on for years. The brain ramps up attention and activity here and listens out very intently on the next lift for any sensation in your back. Remember, this is descending facilitation. On the other hand, another person doing the deadlift can feel the same thing. They might be used to feeling muscles get sore when training. They know deep massages hurt and foam rolling is sore, and they believe they are strong and capable of this lift. They also want to train hard. On that fourth lift, the brain shows far less interest and it can actually block signals. This is descending inhibition. This is what's meant by the drug cabinet in the brain. Chemicals are released that descend down the spinal cord and block the danger receptor signals. These chemicals are enough to help people overcome catastrophic injuries and endure a host of events that would hurt lots of other people. Some people have well-trained internal drug cabinets, others have drug cabinets that don't work very well. Having experienced pain deadlifting and avoiding it for 2 years can be overcome by coaching, reassurance, and graded exposure to these lifts. Here you are training your body, but also training your brain and your internal drug cabinet. That's why in order to overcome pain, you need good experiences of exercise and movement, information, understanding and reassurance, and movement options. Understanding pain better is definitely helpful, but most people don't suddenly read something and become cured. To fully regain your life and all the meaningful activities that you value and enjoy doing, you have to do the work, and that has to involve movement and some form of exercising. If you have any questions or you're unsure about your own situation and you want some help, feel free to reach out or comment below and we'll get back to you.